I'm Alfred Poor. I'm here at the Digital Health Live studio at CES 2019. And I'm talking this afternoon with Stuart Patterson. He's the CEO of LifePod. And it's a interesting product because one of the things I've noticed here at the show here is that companies are spending a lot more attention to the interface to help engage users, to help keep them using the product so it doesn't end up in a closet, in some drawer. Tell me a little bit about your project and why you're focusing on the interface and what you're doing.
Sure. It's a pleasure to be here. Pleasure to be talking to you today, Alfred. We are voice user interface specialists, really. And what we're bringing to market with the LifePod service, and we really are a service. Our smart speaker is just another Alexa inside box, if you will. But what we do is we give it that new way where it talks to you. And the way it talks to you is it talks to you under the control of your caregiver, which in the healthcare industry, of course, is paramount.
Sure.
Is it and we started in the market for the elderly aging in place. And on the back of our business cards are pictures of our parents that we took care of. In some cases, my head of business development has an autistic son. He's been caring for his autistic son all his life, and he views this ability to set up a schedule that the smart speaker with Alexa inside will speak to his autistic son or his father, or father-in-law in this case, as really being a breakthrough, which it is.
So this is more interactive than just, hey, it's time to take your pills.
Right.
Okay.
In fact, it does say that. So it might say, good morning, John, how did you sleep last night? Which is pretty pleasant if you're spending 16 hours a day, 7 days a week alone, to have a friendly voice say, how did you sleep last night and how are you feeling? And don't forget to take your medication, like you just said. But we actually create a little conversation. So unlike the sort of fire and forget model of the virtual assistant, which is I ask you one question or I give you one command of play music or something like that, this is actually a little micro dialogue. We call them micro dialogues that could be around whether you took your medicine. It could be, don't forget that your grandson's birthday is today. Would you like to call them? And then you could call them. Or it could be, how are you feeling after you took your medicine? And if you say, I'm not feeling well, it'll continue the conversation and say, oh, would you like to alert your caretaker, your caregiver? And we will send a text automatically that's been configured, of course, by the caregiver to alert them that they need to be called by call their patient.
So there's that creepy valley problem that we have with some technology, and some people have, especially seniors, that putting a camera to monitor them.
Right. It's
a real problem. How are people responding to this kind of a technology in their home?
The response so far has been astounding. As I said, many of these people are alone a lot, living alone. The numbers of millions of people living alone after the age of 65 is mind-boggling. But in addition, the ones that we've done the most testing with generally have complex medical conditions and many chronic diseases. And so they have professional caregivers who come and visit them. This gives them a presence that helps them through every day with reminders, so they can leave the reminding part to their LifePod service. And the caregiver has set it up for them. So there's no creepy factor.
Good.
Whether it's your son or daughter who set it up for you, or the professional nurse or doctor who set it up for you, it's really a nice connection. And they're now calling these things their friend or their, and we don't currently work with the Echo Show or the Google with a screen. I'm sure we will for some applications, but just the voice is really the key here. It's the most natural interface, and the users love it.
A comforting human touch.
Right.
I can see how that could be very powerful.
And I should mention also that we're so excited about our partnership with Mobile Help that we announced a couple days at this show, because Mobile Help is the leading provider of not only I've fallen and can't get up kind of technology, which is known as PERS, as you know, but also of mobile vitals tracking, which is tracking your blood pressure, tracking your heart rate, tracking your weight or something like that. These are all things that will be an added value for people with diabetes or people at risk of congestive heart failure. And since we're at the 10th anniversary of digital health, I think that's a pretty big breakthrough, that these will now be able to talk to you through the day and provide that feedback to the professional caregivers who are the medical professionals.
It's astounding how far we've come in 10 years.
It is.
Thank you so much.
My pleasure.
Once again, I'm Alfred Poor. I'm here at the Digital Health Live studio at CES 2019, and it's hosted by Living in Digital Times. Thanks for watching.